My name is Minerva Perez, and I have lived in Sag Harbor now about 17 years. We are at the OLA of Eastern Long Island offices, which are located on the corner of Main Street, Newtown Lane in East Hampton Village. So OLA is a nonprofit. We are a Latino-focused nonprofit based on the entire East End. We do work across the East End. We have been a nonprofit foundation since 2002. And our mission includes creating equity across our entire East End with and for Latinos, but not only for Latinos. So our work expands beyond just the Latino population. At the very beginning of the pandemic, it was clear that the community that we serve, inclusive of all different types of folks, whether they are entrepreneurs, wealthy people, laborers, families, children, that the pandemic was striking them in a much harder sense because there aren't systems enough in our communities that really allow, even though this community has been building and here and growing for 30 years at least, if not longer, that in terms of the access to information, the access to language, in many cases, transportation access, ways of getting information about what to do in a case of something that we've never experienced before, that those systems were never working really well. So that when we have an emergency the way we had it, it showed a big gap there that we saw some of the folks who were most vulnerable really fall into. So at one point we had about 75% of the worst cases in Southampton Stony Brook Hospital were Latino. Not because they don't know what a pandemic, not because they knew not to, be with people who were coughing on them, but because they were also deemed essential workers at a time when it was very busy out here. Lots of folks were coming from other places to live out here to escape the pandemic from the city. And many of the Latino members of our community were working in jobs that put them in close proximity to each other. They were working in restaurants, they were doing the cleanup crew, they were working as landscapers, they were getting into trucks and driving to jobs. It was not a safe time for many of our Latinos who were then going back to their families and sometimes multi-generational homes and potentially having other people get ill because of this pandemic. So it was a very rough time, and we were addressing need from the start of it, including crisis food for folks that couldn't get out of their home because there was no transportation. They had children that were not in school because the schools were closed, and they were not able to get to pantries because they had no cars, and we had to find ways to get them food, the homebound and the hungry, to get them food, and a whole lot more. Well, during the pandemic, we did see that the safety issues around public transportation were taking front and center stage, as they should. So for many people, it wasn't safe for them to even be in public transportation. So in that case, it was better that they stay home during the height of the pandemic. We didn't want to see people even going to work if they didn't have to, which is why the work that we've done and we continue to do with connecting people to crisis food was so important, because it let them understand that even if they didn't go to work, that we were going to be there for them and make sure at least the very basic needs of their family were going to be met, so they didn't have to put themselves in danger or anyone else in danger. In terms of public transportation, the most critical piece that we saw were the folks that needed to get to a doctor's appointment that wasn't a COVID appointment. It was a cardiac appointment or an OBGYN appointment or a cancer treatment. These were kinds of things that you couldn't really hold off. And we found in that arena, it was very, very difficult to connect people. Also elderly, whether they were Latino or not, some of the services that the town provides or that the county provides were either stopping or slowing down because it was dangerous to have people in a vehicle, which we understand. But then there became this further isolation, which led to some other work that we're doing a lot more right now on the mental health end of the spectrum. So from the very beginning of the pandemic, the first deficit that we saw is that there were not enough access points to testing. So first we had to address testing, and after we addressed testing, then we had to address vaccines. Not about vaccine hesitancy, about vaccine access. All we needed to do was get the vaccine in a place where someone could get it, and then people were taking the vaccine. We are still not seeing a large number of hesitant people with vaccines. We're seeing a continued lack of access to the vaccine. So OLA is working right now. We started back then and we're doing it right now in a very amped up effort. We have a grant from the CDC Foundation to specifically get more and more vaccines out there and better vaccine education. We're working with Northwell Health, Stony Brook, Southampton, and Sun River to create pop-ups around the entire East End. We've got one that just happened in Springs at the church, at the food pantry. We've got one that we're working on in Riverhead, in Bridgehampton, in Montauk, in Greenport. That is the work that we're committed to doing. I'm going to speak about a person, actually, who came to our aid. when we were getting a lot of phone calls from people that weren't even just in the East End. They were in Wyandanch, they were in Lindenhurst, and they had no food, no way to connect to a pantry because they had no car. And for whatever reason, either they were, health compromised, or they had small children and school was closed. And we reached out with a bit of a Hail Mary, and asked for some sort of support. And we did that on social media. And a gentleman reached out to us and said, okay, I live in the Lindenhurst area. And we said, we have 5 families in that area. Can you possibly help us? And here's what we need you to do. We need you to go to a grocery store, buy an entire week's worth of groceries for each one of these families, drop it off, pay for it with your own money, send us a picture of that receipt, and we will send you that money in about 7 to 10 days. I've never met the man. I didn't know if he could trust us, and he did it. And we did send him the check, and he did that for us for pretty much the entire first round of the epidemic, the pandemic, before the summer came. He was completely committed to making sure that he was shopping for these families every single week with his own money, and then getting reimbursed by us. And all during that time, his wife was pregnant, and this was a Latino man in the Lindenhurst area. During the pandemic, the mission of OLA absolutely expanded. This is all still within our mission, but in terms of the scope of work that we have been able to do, I don't think I could have dreamt that we were capable of this. So we have grown at least 3 times during this pandemic, and not just for pandemic work, but because we are seeing that there are other aspects of long-term work that we need to be committed to out here, because a pandemic doesn't happen and then go away. We've got economic recovery, we've got health equity that we have to address, we've got transportation, we've got a whole host of things. We've got mental health care for our adolescents that is not adequate. We need to be committed to these things because we see that we can. I'd say compassion. I felt a lot of that from all different areas of our community, all kinds of support and compassion for what we've been going through or what our neighbors have been going through. It's been a long road. We're still on that road, but compassion is what I feel the most of.